Proudly sponsored by Northwest Specialty Hospital. Inland Life Health Innovations, highlighting our region's great medical resources.
Welcome to Inland Life Health Innovations. I'm Julie Delaney. Well, as women, we can be suffering signs and symptoms of fibroids and not realize it. I'm here to talk to Dr. Young about what those are and how they can be treated.
Fibroids affect up to 80% of women, so it is very common, as you mentioned. Certainly by about the age of 50, 80% of women will have one. It depends on what age a woman is in, how a fibroid may affect her. It is an overgrowth of the muscle wall of the uterus, and so earlier on, when people are trying to get pregnant, can often affect fertility.
You and Northwest Specialty Hospital Women's Care have a specific approach and some technologies that you're using that are unique to you guys in this region.
I've been trained in the Excite technique, which came out a few years ago, where we are able to maintain that minimally invasive or laparoscopic approach, even for very large fibroids. So patients who walk around looking like they're 20, 30 weeks pregnant, we're still able to target those fibroids with this minimally invasive route, helping them to avoid a very large incision with the complicated post-op course that may entail. Some of the patients will go back to work, 2 weeks after surgery. Some patients haven't even required any pain medications after surgery. Most patients are able to go home the same day, so they don't require an overnight stay in the hospital or this prolonged recovery.
Is there somebody that's more predisposed to have them?
The number one risk factor, actually, is whether you had a grandmother or a mother who had fibroids. You are much, much more likely to get fibroids and more of them earlier in life. Other things like being Black or Hispanic tend to have a higher rate of fibroids as well.
To learn more information or to connect with Dr. Young, visit nwsh.com.
Proudly sponsored by Northwest Specialty Hospital.